Hello everybody, I'm Dr. Vikram Mhaskar, a knee and shoulder surgeon from New Delhi, India, and welcome to another video in which we're going to be talking about this particular operation called a partial knee replacement, an operation where only 1/3 of the knee is resurfaced, 2/3 is left the way it is. It's a knee preservation operation. Why does it fail? So remember, when you're preserving the knee, what you're typically doing is you're putting a substitute for the cartilage. So this metal stuff made of cobalt chrome is basically caps which are substitutes for the cartilage, much like wallpaper instead of paint. So can you see these caps sit on bone like this, top, bottom, and there is a substitute for the meniscus, a shock absorber in between. Now, if these caps are not placed properly, that means they're placed a little bit on the inner side, outer side, or excessively outward or inward, they can toggle, they can fail, they can get loose over a period of time, they can rub against the ligaments on either side, because this particular operation is dependent on ligaments in the knee. These ligaments are preserved in the knee. None of them are removed in a partial knee. If they fail, the operation fails. So it's important that the components are placed properly so that they don't depress, get loose, or rub against the ligaments on either side. Number two, there should be a right alignment. If the alignment at the end of the operation is not okay, it's excessively bow-legged, even after the operation, there'll be too much pressure on one side, and ultimately the component, even if put properly, can subside and cause problems. Third, this little meniscus in between, or the poly, can just fly out if the tensioning is not properly done in the ligaments on either side. Hence, these operations should be done by specialists like me. Very important the tensioning is right so that it doesn't come off. Apart from that, infection, which is a realistic possibility in any operation, especially in patients which are immunocompromised, uncontrolled diabetics, people on steroids. So important to control these things before the operation and then do it, because this is a life-changing operation, not a life-saving operation. So you optimize the patient physically and mentally before the operation so that this untoward complication doesn't happen. Another good important tip is disposable should be used to minimize the chances of infection. Apart from that, very important to do the right physiotherapy, because remember, these caps, the knee is the wheel of a car. The muscles are the engine of a car. So you may have an old Volkswagen, if you have Ferrari wheels on it, if the engine is the same Volkswagen engine, it's not going to go fast. Important is to get the engine tuned to go fast with good wheels. Engine tune means strong muscles. So strengthening the thigh muscles, hip muscles are very important apart from the operation to do that so that you can get complete benefit of this operation. If they're not strong enough, the operation fails. I hope you got quite a bit of information about why UKRs or partial knee replacements fail. If you like my videos, please like and subscribe to my channel, and please follow me on Instagram. For those who like Hindi content, we have a successful Hindi channel with a silver play button. Please like, subscribe and follow it. Thank you.